teeth cleaning and periodontitis. I mean, you have definitely shown us that having any type of gum disease, any type of infection in anywhere in the body, and especially in the gums, is not a good thing. And I'm sure cleaning prevents a lot of that in the first place. And even though with people who brush phenomenally, still in most cases need to go to a dentist and do a regular cleaning. Here's one question I want to ask you. I mean, obviously I want you to explain a little bit the cleanings and stuff, you know, and all that. I might even want you to explain when a person needs a little more heavy cleaning, a deep skin cleaning, as you mentioned. But one thing I definitely wanted to start off answering is this. Why do some of us have to go 3 and 5 times a year to do a cleaning, and other ones get well away with twice, and even if they miss sometimes one, the dentist still goes, that's all right, you're fine. Why do some people have to go more often than others?
That's a great question, Helmut, and it's the same basic reason. Why do some people have to have their appendix out and others don't? It's about your own body and how your body is treating or is handling the bacteria buildup that's inside your mouth. Some people are very fortunate. They have a wonderful immune system and they have wonderful habits. So they're brushing and they're flossing and their immune system take care of almost all of the bacteria that's in their mouth. So when they come to see us 2 times a year, we see no infection in their mouth. Their gums don't bleed. They don't have mouth odor. And their habits every day, they're brushing 2 or 3 times a day. They're flossing their teeth every day. And they come to us infection-free. So the reason they come to us is because even with their brushing, the biofilm still does start to build up. And we want to encourage them that with a polishing of their teeth, we can handle what little biofilm that may still build up with them. But overall, they don't have the infective process taking place. Others are not that fortunate, either through their own genetics or their habits or their history. They may have suffered from some form of gum disease or another. Some have what we call intermediate gum disease or gingivitis. And in that situation, coming in 3 times a year or 4 times a year because their own immune system will not help them. Even though they may be brushing every day, even though they may be flossing every day, their immune system just doesn't take over for the rest of it. And they need some physical instruments to break up the biofilm and the plaque and the tartar that have built up on their teeth so that the other plaque won't then adhere to their teeth as much. So they need to come in more than that. The deeper cleaning now is when that process is carried underneath the gum line and where it's starting to affect the roots of the teeth and the bone that supports the roots. Once that happens, there's really no turning back. The gum disease process affects about 75 to 80% of adults over 40 in some form or another. Whether it's gingivitis or severe gum disease, 80% of adults over 40 have this disease and need to be seen by a dentist to control the bacterial buildup underneath their gum line.
So basically, we have the brushing, which takes care of lots of stuff, and the flossing, of course. That doesn't take care of everything, so now we need to go into the dentist scraping it with instruments, you know what I mean, like an ice pick type of stuff. And then sometimes that's not quite enough, and you need to actually go a little bit under the gum, so there's always some type of surgery, at least heavy scraping involved, at which point people usually need a little injections already because you're really going into the meat here, right?
Otherwise, it's too sensitive, yes.
Right. Okay. Now, if a person does this, I mean, you have talked about how a gum disease, affects the kidney, the liver, the brain, dementia, and of course the heart, diabetes, premature born babies, and the immune system in general, weakness, kind of sluggish throughout the day, name it.
Sure.
Because an infection is an infection, it eats away from you. And it can literally, once it is there, there's only one way to cure it, and that is to kind of cut it out. I mean, you guys have many ways these days of, you don't necessarily call it cutting, but cutting, scraping, or lasering it out somewhere is about...
Physically removing it would be a good way to put it. We have to physically remove the bacteria from your mouth because there's no magic pill that we can take.
Got it. Now, if a person takes care of obviously the first stage, the cleaning, but then also the second stage, and comes when the dentist says, whether the dentist says every 2 months, every 3 months, every 6 months, whatever he says, he kind of keeps that up. And then the dentist does do his cleaning or his deep scale cleaning, whichever way that advances, and keeps doing that. Can a person actually say that he can, for all purposes, leave gum disease free and doesn't have the danger of those other organs getting damaged, yes or no?
Absolutely. If somebody is that dedicated and they are not only doing their part at home, because even if they come 5 times a year, that's 360 days they're doing their own at home. We only see them 5 of the days out of the year to do the cleaning. So if somebody is that dedicated and they're doing all those things, absolutely we can guarantee that they're not going to have gum disease. Because gum disease is a buildup of bacteria in places that have not been kept clean. And if they are being kept clean, then they will be free of gum disease.
Which means free of, as we said, all those particular potential illnesses,
yes.
including keeping teeth. And is it true that there is scientific or proven data, out there that people who apparently have a healthy mouth for a long, long time, and the ones who have as more good of their own teeth they have in it, which usually means they didn't get too much gum disease, not always, One can be Rocky Sylvester Stallone and get a few things knocked out. That's a different ballgame.
That's a different story.
That those people actually live longer and overall are simply healthier. Is there really a correlation to it which can be pinpointed, with you doctors?
Sure. There are many things many factors that go into longevity, but certainly that's one of them. If you have a stronger immune system because your mouth is healthier, if you have a stronger heart and circulatory system because your mouth is healthier, if you have stronger lungs and kidneys, certainly the stress on your body, barring other things, certainly people can be gum disease free, but they can abuse their body in other ways. But if somebody is that dedicated and they are concerned about healthful living and they do these kinds of things, by and large, the average person will have a longer life, a longer, healthier life, than somebody who neglects their body in one of a variety of ways. Certainly their mouth is the leading factor in that neglect.
Well, so I guess, the mouth definitely is the gateway to your body, not just only putting French fries in it, but other things also.
That's right.
Well, Dr. Jones, again, very nice talking to you. Bye-bye.
Thank you. Bye now.